Good morning. Welcome to the San Mateo County Community College District Public Forum on its draft ADA plan. We'll get going in just a minute here. We'll allow a little bit of time for attendees to log in. All right, I think we will go ahead and get started. It's 9:02. Welcome again to the San Mateo County Community College District Public Forum, the first of two public forums on its new draft ADA plan for the district and its three colleges. I'm Rich Rojo. I'm doing district communications and hosting your webinar this morning. I just want to go through a few housekeeping items before we get started. So for audience members, the chat is disabled. You will not be able to use the chat in today's webinar. We have two ways for you to comment or ask questions. The first way is, if you look down at your toolbar, in the lower part, you'll see a Q&A button, and you're welcome to click that button and type a question there. The panelists on today's webinar will see your question, and someone will be able to answer. We'll be able to answer live during the webinar. If you have a question that you'd like to ask kind of in person, please just click raise hand on your toolbar. And at the end of the session, we'll do a presentation first. At the end of the session, we'll have a Q&A section so that will allow you to speak and get your question answered. As you may see, we have ASL Interpretation available now. I've spotlighted the ASL interpreter, Elizabeth Traeger. There's another interpreter also, Carol Hodgkins, who will be switching off. So if you are using ASL, please feel free to pin Elizabeth's and Carol's video to your screen so that you can see that easily. And finally, we are recording the webinar this morning, so please know that everything here will be recorded, and the webinar will also become part of the ADA plan itself and part of the record, public record on our ADA plan. With that, I would like, excuse me, one other thing. And we will be turning on live captioning also. So give me a moment, excuse me. Turn that on. All right, with that, I'd like to introduce the Chancellor of the San Mateo County Community College District, Mike Clare, who will give a welcome, and then we'll get into our presentation. Mike?
Thank you so much, Rich, and good morning, everybody. Thank you so much for participating and for your opportunity to provide feedback to the transition plan. I was commenting to the group before we officially started, this is important work. If you look at the mission of our district, if you look at the mission of our individual colleges, everything is about access and equity. And it is important that our physical campus be accessible to all students. And that's why this work is so important. So I look forward to hearing your comments on the transition plan, and more importantly, I look forward to us implementing the plan. So thank you very much.
Thank you, Chancellor Clare. Hi, everyone. My name is Chris Strugarfrich. I'm the Director of Capital Projects for San Mateo Community College District. And I want to give you a little bit about the purpose of the meeting, the history of the project that we're working on, and briefly go over a couple of the parts of the ADA plan. So the purpose of this webinar is to provide and inform the public about the district's ADA plan and the project itself. And the reason we're doing this is we want to inform the campus community, our students, our faculty, our employees, as well as the community at large, how the plan is set up and structured, what the process was for developing the plan. And we want to show you where you can find it and how you can comment on it. The plan is currently in a draft form, and the public comment period will be open until the end of October. We think it's crucial and very important for the plan to be successful to get community input on the plan. The more information we can have and incorporate into the plan, the better it will be, and the better the plan can help serve the San Mateo Community College District. A little bit about the history of the ADA plan at San Mateo Community College District. The district has had an ADA plan since ADA was incorporated into the law of the land in 1990. And the last time it was updated was in 2010. And we decided it was time last year to revisit the plan, review it, and update it as necessary. The district's been engaged in capital improvement programs for the last 15 to 20 years. CIP Program 1 was completed approximately 10 or 12 years ago. CIP 2 was completed about 6 years ago. And then we're in the midst of Capital Improvement Program number 3. And even though the district has done a lot of improvements to the facilities throughout the district, we need to review the ADA plan. It's not static, it's a live plan. It needs to be reviewed and updated continuously for a number of reasons. One is the environment does change, the built environment changes. The needs for our students and serving our communities change, but also the building codes change. And even though we've completed capital projects as long ago as 2005 or 6, in Capital Improvement Program number 2 in 2010, 11, 12. And then recently we've completed some projects at Skyline College and at Kenyatta College. Because the building code changes every 3 years, we need to revisit the ADA plan and make sure that as the code changes, we've identified the barriers and come up with a mitigation plan. So what we did was about a year ago, last April, we identified the need to update our ADA plan, and we hired Sally Swanson Architects as our consultant. Sally Swanson Architects is an expert in ADA design. Sally Swanson herself actually is internationally renowned as an ADA expert. She served on the Paralympic Committee to make sure that Olympic venues throughout the world during the Olympic years have accessible facilities and services. We also have identified our project manager. Her name is Heidi Rank, and you'll be hearing from her during this presentation. She's with Swinnerton Management Consultants. And so that's how we started our project team. And then we reached down into each college and identified the director of the Disabilities Resource Center. We involved the folks from Student Services, and eventually HR was brought in so that we could look at how the services are delivered to employees, our hiring practices. And we interviewed in people from the library staffs, the public safety departments, ITS, auxiliary services, our facilities maintenance and operations teams, athletics, and student services. What you'll hear in the presentation this morning, you'll hear about the plan, how it's formatted. The plan actually has two parts. There's what's known as the ADA transition plan. That portion of the ADA plan identifies the built environment and what are the barriers that keep someone from being able to access our facilities and our grounds. And to generate the transition plan, Sally Swanson Architects surveyed all of our buildings and all of our grounds in 2019. We've generated a report. I think we've surveyed hundreds of miles of sidewalks on the campuses, all the buildings and all the facilities. And the second part of the plan is once people are on our campuses and they've gotten into our buildings, there's what's known as the self-assessment surveys. And what that does is it helps inform how we're delivering services to people. So if a student comes in and they need financial aid and they require accommodation for receiving financial aid counseling, how do we provide those services? How does ITS provide a website so that it's accessible for people that require accommodation? And so we take a very holistic look at our entire campus array of services and how do we deliver those services for people requiring accommodation. And so that's in a nutshell what the plan is. And what I'm going to do now is I'm going to turn it over to Sally Swanson Architects. They're going to go through the plan, what the findings were, how the plan is structured. And then later in the presentation, Heidi Rank is going to talk about the implementation of our ADA plan. And then Rich will come back on and he'll show you how to access the plan if you haven't already been able to find it. So thank you. And with that, I'm going to turn it over to Josh from Sally Swanson Architects.
Thanks, Chris. You just made my job super easy by explaining all of that. My name is Josh Klipp. I am the ADA Policy Specialist for Sally Swanson Architects. I am also an attorney specializing in the ADA and also a certified access specialist. So I'm going to give you just a little bit of background regarding the law and this process. So Nico, if you could forward the slide, please. Okay, so as Chris mentioned, the ADA was passed in 1990. So that means we celebrated its 30-year anniversary of this year. And why do we need it? I think anybody who has ever had even a temporary disability understands the importance of access in both physical and non-physical environments, virtual, digital environments. And in the last many decades, we've had a lot of changes that have required or that have underscored the importance of the ADA. For instance, medical advances that allow us to be in our physical environments for longer and to interact differently with those environments. Secondly, increased lifespans. So as we get older, as our lifespans are lengthened, we get older, our bodies will break down, but we will be out there for longer. So that's another reason why accessibility is incredibly important. We also have a number of returning veterans, and I think senior citizens sort of ties back into the increased lifespan. And then just the importance of implementing the ADA in planning and construction. As many of us know, buildings prior to the ADA are, by and large, completely inaccessible. Next slide, please. Okay, so this slide describes the district's responsibilities under the ADA. And to be specific, this is the ADA Title II, which applies to entities such as this, governmental entities. And what this prohibition states is that no qualified individual with a disability shall, on the basis of disability, be excluded from participation in or be denied the benefits of the services, programs, or activities of a public entity, or be subjected to discrimination by any public entity. And then the bottom half of the slide here describes the ADA's particular legal mandates. And so this is a little bit of what Chris has already described here. Sorry, I need to turn off my captioning so I can get to the bottom, hide this subtitle. There we go. The self-evaluation plan, which is what we're going to talk a little bit about, the transition plan, which is what my colleague is going to talk about, an ADA notice of compliance, which is something that has been reviewed as part of this overall evaluation, grievance system, which has also been reviewed, and also the appointment of a responsible employee for implementation of these programs. Next slide, please. Okay. This next slide here is titled Self-Evaluation and Transition Plan Key Components. This is echoing a little bit of what Chris has already talked about, what I've already talked about, but just to review what it is a survey of the built environment, a survey of program services and activities, a plan for barrier mitigation, which means reducing and taking down those barriers, a schedule for barrier mitigation, and an appointment of a district official to administer this plan. Next slide, please. This is you, Nico.
Thank you, Josh. I'm Nico Samovic. I'm with Sally Swanson Architects. I'm ICC certified. And so I'm going to talk about the physical aspect of the transition plan process. So when most people think of ADA, we think of the physical space, you know, ramps instead of staircases, automatic door openers, things like that. So the transition plan process, we documented all the architectural barriers where programs take place in the district. So that's surveying all the facilities, all the buildings, all the sidewalks, curb ramps, parking, everything that you can think of that is physical, we surveyed it. And then we provide solutions, so make alternations to provide program access. So this is where we provide solutions. And we also did a description of the structural modification that will be needed, as well as a timeline for completing the work. So our facility survey methodology starts with the exterior portions of the campuses. So if a person can't access the building or get to the front entrance, there's no way for them to access the services and programs within the building. So our first look is at the site arrival points, the parking, transit, any drop-off, as well as the front entrance and main lobby. Secondly, we look at the interior spaces where the program's access occurs. So we look at classrooms, we look at cafeterias, bookstores, things like that. And then we also take into account supporting elements such as restrooms, drinking fountains. And then lastly, for Title I requirements, we looked at all the staff-only areas within the facilities. So the transition plan update, the current status is that we have conducted a full assessment of all the barriers at the district office, Kenyatta College, College of San Mateo, and Skyline College. And then we have completed a draft transition plan. So moving forward, we are going to need to create funding and a budget to commit to ADA improvements, internal project review for ADA compliance, identifying any current or future projects, such as capital improvement projects that can kind of mitigate these barriers as they're occurring, and then the ongoing tracking and monitoring of the transition plan. So some of the findings that we found, this is kind of just general over each college and district office. We kind of broke it up to see what was the most common barriers. So for example, at Skyline College, there was a lot of reach ranges or protrusions that we found. Door vision lights were too high and door pressures were too heavy, and some restroom violations, mostly accessories, things being too high or in the wrong spot. And then College of San Mateo, also restrooms, reach ranges and protrusions, door vision lights, kind of common across all of the campuses. And then this is the transition plan reports and database. So when you click on the link on the website, the district website or any college website, you will find the report. And this is what you'll kind of see is the example report layout. So in here, it kind of shows you the facility that was surveyed. It shows you whether it was interior versus exterior, and what floor. And then it also kind of goes through each barrier individually. We have a photograph, we have the description, the as-built measurement that was taken during the time of survey, as well as the proposed solution. And any relevant codes, whether that be federal or California building code. And then we also provided a preliminary cost estimate, as well as we kind of created a ranking system for priority and severity to help the college determine what they should focus on first and what needs to be mitigated first, depending on how severe it is from the code and then where it's located, on how a person would reach that program or service. And then I'm going to pass it back to my colleague Josh to talk about the self-evaluation.
Thanks, Nico. So a lot of people are not always sure what the self-evaluation process is and how that kind of fits into all of this. A lot of folks think of accessibility as purely within the built environment. So a lot of the things we've been talking about, public rights of way, restrooms, grab bars, accessories that are attached to walls, things that are in a physical space. The self-evaluation process essentially looks at everything else. So all of the ways that humans interact with other humans, that services are delivered and received, so that sort of thing. What we did here is, as Chris described in his introduction, is essentially we did a subject matter survey. So we took a look at things like library services, emergency services, human resources. We broke it down area by area. So everything from printed and written communications to communications with persons who may be deaf or hard of hearing, to the grievance procedures, those sorts of things. We did all of those subject matter surveys, took a look at all of the responses, brought all of that together, created a report with recommendations, and then took those recommendations and put them into what's called a work plan. And a work plan is effectively, we call it a living document. It's not something we just hand over and then it just sits dusty on a shelf somewhere. It's actually a document that is capable of being implemented in the same way that the barrier mitigation plan Nico just described is capable of being implemented. But again, in the context of program services and activities, as opposed to, say, the built environment. Next slide, please. So the current status of the self-evaluation plan is that district offices and campuses have already received those, completed those, and the evaluation has been complete, as well as the draft self-evaluation report. And the work plan does take a look at what is a recommended best practice versus what is the legal requirement. And then it's going to be finalized, the report will be finalized in consensus with the district, and there will be, again, identifying grievance procedures as part of that and ongoing tracking and monitoring of the work plan. Next slide, please. This is an example of what the self-evaluation work plan looks like. So you can see there that there's sort of a department that a recommendation is assigned to. You can see in the column 4 from the right there, or I'm sorry, 4 from the left, what the recommendation is. And then there are columns stretching out to the right there that this is effectively what makes it this working or living document, in that you can assign these recommendations to a specific person for implementation and then set your milestones, due dates, whether there's been training done, adding any notes from a district level, et cetera, et cetera. Next slide, please. So this is just an example of what some of the self-evaluation findings and recommendations were. I'm going to try to reduce your Zoom fatigue and not read all of them to you out loud. I will read a couple here, but I will note that Richard has put in the chat a link to the draft plan and the self-evaluation recommendations. So you can click on that or copy and paste it, put it into your browser, and take a look at what all of those recommendations were. But just to give you some examples here, for Skyline, for instance, creating policies and practices to ensure accessibility of online and digital instructional materials, which in the age of COVID really could not be more important, could not be more relevant. For Kenyatta College, for example, ensuring that campus phone lines, including 911, are accessible to persons who may be deaf or hard of hearing. College of San Mateo, an example is offering training on disability civil rights mandates for campus security officers. and the district office, for example, laying out reasonable accommodations clearly in writing and in detail. Next slide, please.
Hi there, this is Heidi Rank. I'm the in-house project manager for the ADA project. And so part of the, we have to set up, like, how do we get started on removing barriers? So I took a good look at a lot of the physical barriers and thought, well, let's see here. What can we do this year, up to the fiscal year ending at June 30th? So I thought, well, how about we could remove readily achievable items while we're going through this process. And that would be, here's a list of a few of the things that we could do. Also, preventative maintenance. We do have a stellar maintenance staff and facilities that does take care of things and goes around and adjusts door closers to make sure that, you know, doors open smoothly and all the way. They trim vegetation, they move furniture items out of the way that might impede on clear door space for people. There's also complaints. We do receive some complaints. I've even reported some things like where the vegetation is growing over a handrail, where I saw somebody having a very difficult time maneuvering a stairway. And so again, facilities takes care of these things as best they can and immediately as they can. I've contacted all the vending machine vendors, because some of the vending machines have been there for a long time, and they're where you actually put your credit card in is too high. It exceeds the reach ranges. So we're taking care of that right away. And then this last part is less physical. The training is more of a programmatic issue, but we're going to start training custodians and facility people and grounds people how to identify barriers, such as vegetation that's in a path of travel. Or lots of times somebody will take a trash can in a restroom and go, here's a nice clear space to put this trash can, but guess what? That's how somebody in a wheelchair, they need that space to be able to access the doorknob. So for this first year, we decided let's do some easily achievable items. And we have like 5,000 items that we have to take care of. Next slide. So then in subsequent years, we've got about $30 million worth of barriers to remove. And you could easily sit there and say, okay, for the next 10 years, we're going to take care of $3 million a year. And that is good. But we are taking care of this year around $500,000 worth of work. And then next year, fiscal year 21-22, we have a lot of capital projects, as Chris mentioned, our capital improvement program. I've listed some of the buildings that we're going to be working on just next year. And it shows that we're going to be eliminating at least 575 items that have been identified by Sally Swanson. And it comes with a pretty big price tag. So next year, we're going to be knocking off quite a bit of that $30 million. Now, this is a dynamic process. Things will come up and be added to and removed. So for the following years, I anticipate that the district anticipates that we would budget $3 million a year, and then go with Swanson has provided a severity score and a priority score, and we could make a list year by year on what we're able to achieve, as well as taking care of all the items, preventative maintenance and training and complaint-driven removals. So next slide. I just wanted to show this because I think sometimes visually this helps to show like readily achievable stuff that we're going to be doing. Over at the district office, you can see these cars are parked here and there's no wheel stops. So the cars could go all the way up and encroach onto that sidewalk. So if you were in a wheelchair or needed an extra wide berth for some reason, you might not be able to get by. So easy fix. Get some wheel stops, put them in so that cars can't encroach on that sidewalk. Another one of my favorite items here, because I think that this is, this helps everybody. Have you ever gone down a stair and seeing contrasting color on the tread edge? I've missed the stair all the time. I'm able-bodied, and that helps so much to have that. And that's an easy thing to do. Even maintenance can do that. So that pretty much, Chris, I think you're the next slide.
Thanks, Heidi.
You're welcome.
So what I'm going to talk about now are the next steps in our timeline. And essentially, we're in what's known as the public review and comment period. The ADA draft plan was posted on September 8th on all 3 college websites and at the district website. And it's open and available for anyone in the public, our faculty, our staff, our students to review that and also to comment on it. And then on October 31st, we'll close down the public comment period, and then we will integrate the comments into the final draft of the plan, along with the responses to those comments. And the finalized implementation plan will be developed in November of 2020. And then we plan to present the ADA plan to the Board of Trustees for adoption at the December 9th, 2020 Board of Trustees meeting. And one thing I'd like to note is the way the plan is broken out is it has the 2 parts that Josh and I talked about, the transition plan as well as the self-assessment. But it's been categorized based on, there's a plan for the district office and then one for each college. And within those 4 segments, there's the 2 parts of the plan, the transition plan and the self-assessment survey. And then within each of those is the mitigation implementation plan. And what we'll do with the comments that we receive, there's a fillable form, and Rich is going to show you how to access this in a few minutes. And on that form, we'll also provide the response so that the question or the comment and the response are in the same form. And then those will be incorporated into the final plan as an appendice for each college in the district. So with that, I'd like to turn it back over to Rich, and he can show us how to access the plan.
Thank you, Chris. So this slide shows you where you can find the ADA plan. I did post a link into the chat, so you should be able to click on that link and get right to the district's ADA plan website. You can also go to any of the college homepages, and their news stories all have items about the ADA plan listed in them now. Or you can go to the district homepage, smccd.edu, and there's a link there from the homepage. Nico, I'm going to take over the screen sharing here so that I can show the district's ADA plan website. Okay. So if you go to smccd.edu/ADA2020, you'll find this website. It gives you a little introduction of what is going on here. We've listed our public forums. As you can see on this page, this is the first of 2 public forums that we're doing today to get public input and comments. And then, as Chris mentioned, there's a link right here to a feedback form. I'm not going to click it yet. I want to show you the rest of this page, but this takes you to a form where you could submit your feedback. Then the ADA plan, we've divided it into a whole table of contents here, so you can download the whole thing, which is the link at the top. It is extensive, 4,000 pages or more. There's a PDF here that you can look at. There's also an executive summary that you can download. And then you can navigate by district location. So if you're interested, let's say you're a student or an employee at one of our particular locations, you can look at the self-evaluation or the facilities report for the district office. Same thing for Skyline College, the self-evaluation, facilities, sidewalks, and curb ramps. The college campuses have more sections in this report. Kenyatta College, same list of things, and at College of San Mateo, same list of things, as well as pedestrian signals, which CSM has. The prioritization criteria are listed here if you want to get to, right to those. The barrier mitigation schedule that Heidi was just showing you is available here, and another link here to our comment form. Some of the highlights that Nico shared are also listed here on the website. So this is how you get to the ADA plan itself. And then if you would like to send in comments or ask questions, you can click on this feedback button. And this has a form that we would love for you to fill out with any comments you have. You can select which campus you're commenting about, or perhaps it's something that pertains to the entire district plan. Please give us your name so that we know who we're responding to. And in some cases, it would be helpful if you would also, if you don't mind, give us some contact information so that if we want you to clarify your question or we want to get back to you individually, we can do that by email or phone. You don't have to, but it's helpful. Or if you would like a direct response, please list your contact information. And then there's a question or comment field. So have at it. Let us know what you would like to comment on or ask us a direct question. Leave your contact information, submit form, and we will respond to you. As Chris said, all of the comments and questions here on this form will become part of the public record. We'll attach them to the ADA plan, as will the recording and transcript of this webinar. So please visit the website, smccd.edu/ADA2020, and submit your comments there. Nico, I'm going to go back to, you can go back to your screen, please. Nico, can we go back to the slideshow? There we go. And finally, as Chris mentioned, you have until October 31st to submit comments or questions on these websites. All right, next slide, please. We would now like to open it up to any questions that you might have for our ADA experts here on the panel. We also have facilities folks available from all of our college campuses if there are any specific comments or questions pertaining to a district location. If you would like to ask a question, you can either type it in the Q&A box if you click the button at the bottom of your screen, or you can push the button that says raise hand and we'll call on you. We'll give it a little time here. I don't have any questions yet, but we'll give it a little time in case anybody would like to think of one. Okay, I do see a question in the Q&A. I'll just read it aloud because I think this is one we can answer live. Will the campus closure speed up fixes? I don't know if that's probably a question either for Heidi or for Chris.
Right now, between now and the end of the current fiscal year, June 30th, 2021, we are working on identifying those easily achievable measures that need mitigation. So we do try to take advantage when the campuses are closed to get a lot of work done on the built environment. But I don't think we're going to be able to do all the work between now and when campuses would reopen, simply because of the just the complexity and how much work there is. It really needs to be scheduled out. Some of the work will be done in building Kenyatta Building 13, Skyline Building 2, as part of those capital projects. And so some of it just needs to be scheduled as the capital improvement program progresses over the next few years. And then there's budget constraints. We need to set aside $3 million a year starting in 2022, the 2022-2023 fiscal year, in order to fund and start to implement some of the other barrier mitigations. And so while it would be nice to try to come in and do it all while the campuses are closed this year, it's just physically impossible just due to the number of items as well as the complexity and the budget constraints. But we do have a plan moving forward to do as much work as we can between now and June 30th this coming year, and then incorporate mitigation measures in our capital projects the next 2 years after that.
Thank you, Chris. We have another question that came in. Will there be adaptable furniture placed in all classrooms, such as at least one desk for students with wheelchairs, students who are pregnant, etc.? Can someone take that one?
Yeah, I can take it. This is Heidi. I noticed that in the Swanson report that there were a lot of rooms that were identified as we need to have an accessible desk. And I've been doing a lot of remodels, mostly at CSM and Skyline, and have noticed that we do have a lot of those desks. And I have a kind of a stockpile of them that I'm keeping. And so part of the plan is to get those desks and put them in areas right away that need them. And then this is an easily quantified amount because of the way that Sally Swanson has a database that the district is going to be using. We can take that line item and we'll know exactly how many desks were deficient. And then we can either find them on campus or order them and get that. So I would say that that's kind of a readily achievable item.
Great, thank you. I'll give it just another 30 seconds or so in case anyone else would like to ask a question. You're welcome to raise your hand and ask a question live, or you can type it into the Q&A. Before we wrap up the forum and get ready for our afternoon. I think we have another question here. So another question, will all classrooms have adequate equipment to meet the needs of students with hearing impairments, such as microphones and speakers?
Heidi or Nico, can you confirm if we've identified those requirements in the surveys?
So this is Josh. I'd be more than happy to speak generally to that. There's not a requirement that all classrooms have that type of equipment, but there is a requirement that if a student needs that type of accommodation, that accommodation be considered, and that a reasonable accommodation be implemented that allows the student to fully participate in the content in that class. So if that is what is required for a student who is taking a class in that room, then yes. But as it doesn't, there's no requirement in the ADA that every single room have it, but there is a requirement that students who may require one be provided with an accommodation.
Thank you.
Thank you, Josh. All right, well, I'm not seeing any other questions come up in the Q&A or any raised hands. So I think that we can...
Richard, we do have another question.
Oh, I'm sorry. Thank you.
Up, yeah.
Thank you. Okay, let me see. Okay, this question is there equipment ready to transport students who are mobility impaired if elevators are not working for any reason, such as earthquake or fire?
I'll jump in again. This is Josh. So one of the things that was surveyed was the adequacy of evacuation procedures. So we did look at things like evacuation chairs, evacuation processes, having floor wardens, basically training to make sure that there is not only an emergency evacuation plan, but a contingency plan to that plan to make sure that any persons, whether that's staff, faculty, students, members of the public, are in an emergency evacuation procedure, that there is, or an emergency situation, that there is an evacuation plan in place to ensure that everybody gets out safely.
Thank you. Let's pause a few more moments and see if any other questions come up. Again, I just want to put a reminder in for everybody that in the chat, there's a link to the District ADA website. The entire plan is viewable there, and there are buttons and links that lead you to the comment form, which comes directly to us. If you'd like to ask a question and get a response from us, feel free to use that comment form. Again, all the comments and the questions that come to the district on that form will become part of the district's final ADA plan. Yes, good questions. And unless any other panelists see something that I'm not seeing, I don't see any further questions. So I think we will go ahead and wrap up this forum. We will be doing this again at 3 p.m. If you go to the ADA website that we've been pointing people to, that Zoom information is listed. If you know of someone who might appreciate being able to attend and hearing this information, please encourage them to do so. And we will be back at 3 o'clock to do this again. Thank you so much for attending this presentation of the District ADA Plan. It's so important for us to hear your comments and hear your questions. So we appreciate your time this morning. Thank you for attending and have a good day.